Hi, I'm Ashley, Senior Clinical Advisor at Carepatron, and I'm here to help guide you through agoraphobia treatment plans. So what is an agoraphobia treatment plan? Agoraphobia is a mental health disorder that causes intense fear and anxiety when a person feels trapped, helpless, or embarrassed. In many cases, this fear can cause people to avoid leaving homes, which causes significant impairment in daily functioning. This plan can be used to assess, diagnose, and treat patients who have agoraphobia, and it is a customizable tool tailored to each patient's specific needs and goals. Mental health professionals can help their patients identify triggers, as well as negative thoughts to promote positive and healthy mental health. The plan typically asks about the patient's medical history, triggers, symptoms, as well as treatment goals. Mental health professionals can use this information to develop a treatment plan that may include cognitive behavioral therapy, exposure therapy, medication, or a combination of these approaches. Psychologists and psychiatrists, social workers, as well as counselors can all benefit from using this plan. And here's how to use it. The first step is to complete the client profile. You will then need to answer the questions within each section in sufficient detail. Once completed, provide additional supporting evidence if needed. To view a sample plan, simply check out carepatron.com. Within our platform, you can access the plan within our template section, filter by community and by notes or assessment to find the relevant note. Alternatively, you can also search using the keywords.